Hello, my name is Penny Spencer. I'm the Respiratory and Cardiac Occupational Therapist at Harrogate Hospital. My job as an occupational therapist is to promote quality of life and encourage independent living. We know that living with a long-term respiratory condition has a significant impact on your mental health and overall well-being. Therefore, the focus in this talk will be on anxiety management. As human beings, we all get anxious at times, particularly when we're outside of our comfort zones. Health concerns cause anxiety for most of us. It is often when we are feeling a lack of control and are uncertain about the future, or when we find ourselves ruminating about our past. This is a normal human response. Some day-to-day hassles that cause us to be anxious, as well as our lung disease, include attending multiple hospital appointments, organising these appointments. Sometimes the systems can be time-consuming and frustrating. Driving. We all know what it's like to be stuck in traffic, or when we can't find a parking space. What about when someone does not give way or say thank you to you when you have kindly let them go by? Conflict, whether this is with a stranger, the neighbours, or those we care for deeply. Losing someone, reflecting on the past. The cost of living and paying bills can be daunting. Various life events like getting married, moving house, or having a baby all cause elements of anxiety, even though they are often deemed positive life events. Anxiety can make us feel very unwell. It affects how we feel physically. Our muscles can tense up, our heartbeat can become rapid, we can have difficulty breathing and we experience chest pain. We can start sweating, become dizzy, feel sick and our mouth goes dry. We can get blurred vision and we need to go to the toilet urgently. Anxiety affects how we feel emotionally. We feel angry, frustrated and get mad. We can be sad and unhappy. We become uptight and on edge. We cannot relax or sit still. We feel frightened and fearful. We can become tearful and overly worried. Anxiety affects our thoughts and the way we think. We develop a negative outlook. We think that we will make a fool of ourselves. We become disillusioned. We are critical about ourselves or other people. We wonder, what is the point? Anxiety affects our behaviour and the way we perform. We present in an aggressive and hostile manner and avoid eye contact. We act like we don't care. We drink too much or smoke. We can eat too little or too much. We avoid situations and want to run away. We have poor concentration. We have problems sleeping. Now we're going to consider the close link between anxiety and the automatic human stress response. The stress response evolved with the first life on Earth. It is a survival mechanism. We need to take action to save lives. You may have heard of fight, flight, or freeze. These are automatic responses when we take action to save our life or someone else's. In this situation, we do not know how our body will respond. Maybe we'll shut down and play dead as a survival instinct, or run away at top speed. Possibly we will fight back. Stress is ultimately good for us. Super powerful hormones like adrenaline and cortisol surge through our body in preparation to take life-saving action. We also need stress to help us raise our game and perform. We all understand the term stage fright. Can you remember a time when you felt extremely nervous? How did you feel before an interview or before your driving test? Have you ever done public speaking or performed on stage? You may wonder why I'm talking about stress in such detail when the focus of my talk is anxiety. Stress is a response to a real-life threat, whereas on the other hand, anxiety is in response to a perceived threat. With anxiety, you do not need to take action to save your life or anyone else's. Our body does not differentiate between stress and anxiety. Imagine a predator charging towards you wielding an axe, wanting to chop your head off, compared with being unable to find a parking space in a hospital car park. Your appointment is in 10 minutes and you need to walk some distance to get there. This is no mean feat. You may have got up extra early to get ready so you can be at the hospital on time, and you're trying to manage all this with the symptoms of debilitating breathlessness and fatigue. Our body will produce powerful life-saving hormones in both situations. One is life-threatening. The axe murderer is coming to get you. The other is a day-to-day hassle. You're just feeling overwhelmed by the traffic and the appointment. Here, we're not really in danger. The adrenaline and cortisol is not being utilised appropriately. You do not need life-saving mode. It can make you feel more anxious and could result in a panic attack. Anxiety increases breathlessness and an overwhelming feeling of unease. It will zap us of our precious energy too. I hope that you now have an understanding of how our generalised anxiety is triggering our fight, flight and freeze stress responses unnecessarily. Let's consider anxiety management. Think about traffic lights. Red is anger, one letter short of danger. Amber, what is triggering you? Green is safety, it is the calm zone. It is important to learn the triggers that influence your traffic light system. Aim to stay in your green light as much as possible and reduce time spent in the red zone. Be aware of when your lights are changing and learn to adapt. Accommodate any stress by counterbalancing it with calming and relaxing activities. How can we control anxiety? Self-awareness. Remember to identify what is triggering you. Talk about how you're feeling with family, friends and healthcare professionals. Try to identify problems and address them one at a time. Try to focus on the present moment. Learning to be in the here and now is a superpower. Find ways to relax that suit you. This could be listening to music, gentle exercise, meditation, hobbies or crafts. Look at something like a view out of the window or maybe a photograph or picture to help distract you and generate positive thoughts. Use breathing techniques. Using techniques to regulate your breathing can help to tell your body there isn't a real threat. Start with a body scan to reduce any held tension and relax your shoulders. This will allow you to breathe with more ease and more freely in and out of your lungs. Diaphragmatic breathing. Watch your tummy rising as you breathe in and going down as you breathe out. You can feel this by gently placing one hand on your tummy and the other hand on your chest. Aim to move the hand on your tummy more. Try rectangular breathing. This is our natural breathing pattern. Our in-breath is always shorter than our out-breath. Try to focus on nice, long out-breaths. Relaxation and mindfulness. These are skills to learn. It takes time and commitment. Relaxation generates an overall experience which opposes the feeling of anxiety. You could try to relax by looking up scripts online. Look up meditation, guided imagery or visualization. Look up progressive or passive progressive muscle relaxation. Alternatively, you could try an active relaxation technique. Find a local Tai Chi, yoga or Pilates class. Treat yourself to a massage or participate in physical activity. Go outside for a little walk, pot some plants or bake a cake. Mindfulness is about learning to rejuvenate our senses and be able to remain in the here and now. Go for a walk and feel the breeze, or look out of the window and notice small details like the colour of the leaves. You may hear the sound of the wind or raindrops. Notice the shapes in the clouds. Exercise and sleep. Exercise and good sleep patterns can help reduce anxiety. Doing exercise in a controlled and comfortable way is good for you. Remember, it is okay to get breathless to a point where you can maintain a conversation. Slow down if you cannot talk. Establish healthy routines and manage your time well. A good night's sleep can often make you feel more in control and relaxed. Use the breathing techniques I mentioned previously to help you induce sleep with mundane mind activities like counting back from 100 or saying rhyming words to switch off your active mind. To conclude, it is a normal human response to feel anxious. Try not to avoid situations and keep active. Learn what your triggers are. Aim to remain in the green zone by finding a relaxation technique which works best for you. Talk about it, and please be kind to yourself.